Have you noticed it's getting harder to remember names? Or maybe you walk into a room and forget why you're there. If you're over 70, I want you to know something important. This isn't just aging, and it's not something you have to accept. In fact, what I'm about to share with you could be the missing piece that helps you reclaim the sharp, clear mind you deserve. Today, we're talking about 4 specific nutritional deficiencies that are quietly stealing memories from millions of people over 70, and more importantly, what you can do about it starting today. Before we dive in, I want to ask you something. Have you or someone you love experienced memory issues that seem to be getting worse? Maybe it's forgetting appointments, losing track of conversations, or struggling to recall familiar words. Drop a comment below and let me know what you're experiencing. Your story might help someone else realize they're not alone in this journey. Now let me be direct with you. I've spent years working with patients who came to me worried about dementia, convinced their memory loss was permanent, only to discover that simple nutritional deficiencies were at the root of their struggles. And here's what makes me both frustrated and hopeful. These deficiencies are incredibly common after 70, but they're also incredibly fixable. You don't have to sit back and watch your memory fade. You have more control than you think. Let's start with the first deficiency, and this one is huge. Vitamin B12 deficiency is one of the most overlooked causes of memory problems in older adults, and the statistics are staggering. Studies show that up to 40% of people over 70 have low B12 levels, and many don't even know it. Here's why this matters so much for your memory. Vitamin B12 is absolutely essential for maintaining the protective coating around your nerve cells called myelin. Think of myelin like the insulation around electrical wires. Without it, the signals in your brain get scrambled, delayed, or lost completely. When your B12 levels drop, your brain literally can't communicate with itself efficiently. And that's when memory problems begin. But here's what makes B12 deficiency so tricky after 70. It's not usually about what you're eating. Your stomach produces something called intrinsic factor, a protein that helps you absorb B12 from food. As you age, your stomach produces less stomach acid and less intrinsic factor, which means even if you're eating B12-rich foods like meat, fish, and dairy, your body might not be able to use it. On top of that, if you're taking medications for acid reflux or heartburn, things like proton pump inhibitors or H2 blockers, these drugs further reduce your ability to absorb B12. And if you have diabetes and you're taking metformin, that medication is also known to interfere with B12 absorption. So what does B12 deficiency actually feel like? The early signs can be subtle. You might feel more tired than usual, a bit foggy, or notice you're forgetting little things more often. But as the deficiency gets worse, the symptoms become harder to ignore. Severe memory loss, confusion, difficulty concentrating, mood changes, and even problems with balance and walking. The scary part is that these symptoms can look exactly like dementia, and I've seen too many people get misdiagnosed when all they really needed was B12. Here's the good news. B12 deficiency is one of the easiest nutritional problems to fix, and the results can be dramatic. I've had patients who thought they were losing their minds, and within weeks of starting B12 supplementation, they felt like themselves again. Their memory improved, the fog lifted, and they got their confidence back. But you need to do it right. If you have absorption issues, which most people over 70 do, taking a regular B12 pill might not be enough. You might need sublingual B12, which dissolves under your tongue and absorbs directly into your bloodstream, or B12 injections, which bypass the digestive system entirely. Your doctor can test your B12 levels with a simple blood test, and if you're deficient, they can help you figure out the best way to get your levels back up. Now let's move to the second deficiency, and this one is becoming an epidemic, especially among older adults. Vitamin D deficiency affects more than half of people over 70, and the connection to memory loss is stronger than most people realize. Vitamin D isn't just about bone health, it's a critical player in brain function, and your brain has vitamin D receptors throughout areas that control memory and cognition. Research has shown that people with low vitamin D levels have a significantly higher risk of cognitive decline and dementia. In fact, one large study found that severe vitamin D deficiency was associated with more than double the risk of developing Alzheimer's disease. So why are so many older adults deficient in vitamin D? There are a few reasons. First, as you age, your skin becomes less efficient at producing vitamin D from sunlight. You literally need more sun exposure than you did when you were younger to make the same amount of vitamin D. Second, many older adults spend more time indoors, whether it's due to mobility issues, living in care facilities, or simply being more cautious about sun exposure because of skin cancer concerns. Third, your kidneys become less effective at converting vitamin D into its active form as you age. And fourth, if you have any digestive issues or conditions that affect fat absorption, like celiac disease or Crohn's disease, you're at even higher risk because vitamin D is a fat-soluble vitamin. The symptoms of vitamin D deficiency can be vague at first. Fatigue, muscle weakness, mood changes like depression, and yes, memory problems and brain fog. But here's what I want you to understand. Vitamin D does so much for your brain. It helps protect your neurons from damage, reduces inflammation, supports the growth of new nerve cells, and plays a role in clearing out the toxic proteins that build up in Alzheimer's disease. When you're deficient, all of these protective mechanisms are compromised. Getting your vitamin D levels checked is simple, and it's something I strongly recommend for everyone over 70. Your doctor can order a blood test to measure your 25-hydroxy vitamin D level. And the goal is to get your levels into the optimal range, not just barely sufficient. If you're deficient, supplementation is usually very effective, but the dose matters. Some people need just 1,000 or 2,000 IU per day, while others need significantly more, especially if they're severely deficient. And because vitamin D is fat-soluble, taking it with a meal that contains some healthy fat helps with absorption. Also, getting some sensible sun exposure can help. Even 10 to 15 minutes of sunlight on your arms and face a few times a week can make a difference, though this varies depending on where you live and the time of year. The third deficiency we need to talk about is omega-3 fatty acids, specifically DHA and EPA. These essential fats are the building blocks of your brain, and they're absolutely critical for memory and cognitive function. Your brain is nearly 60% fat, and DHA makes up a huge portion of that. It's concentrated in the areas of your brain responsible for memory, learning, and attention. When you don't get enough omega-3s, your brain literally doesn't have the raw materials it needs to maintain healthy cell membranes, support communication between neurons, and protect against inflammation and damage. The research on omega-3s and memory is compelling. Studies have consistently shown that people with higher levels of omega-3 fatty acids in their blood have better memory, larger brain volume, and a lower risk of cognitive decline and Alzheimer's disease. On the flip side, omega-3 deficiency has been linked to faster brain aging, more memory problems, and an increased risk of dementia. And here's the thing. Most older adults aren't getting nearly enough omega-3s from their diet. The best source of DHA and EPA is fatty fish like salmon, mackerel, sardines, and herring. But let's be honest, how many times a week are you eating these foods? If you're like most people, probably not enough. The American Heart Association recommends at least 2 servings of fatty fish per week, but studies show that the majority of older adults fall far short of this. And if you don't eat fish at all, whether it's due to taste, cost, accessibility, or dietary preferences, you're almost certainly not getting enough omega-3s. So what happens when your omega-3 levels are low? Your brain becomes more vulnerable to inflammation, which is a major driver of cognitive decline. Your neurons can't communicate as effectively. Your brain has a harder time forming new memories and retrieving old ones. You might notice you're more forgetful, slower to process information, or struggling to focus. And over time, chronic omega-3 deficiency can contribute to the kind of brain shrinkage and damage we see in dementia. The solution is straightforward. If you're not eating fatty fish regularly, a high-quality omega-3 supplement can make a real difference. Look for a supplement that contains both DHA and EPA, and aim for at least 1,000 milligrams of combined DHA and EPA per day. Some people benefit from even higher doses, especially if they already have memory concerns. And quality matters. Choose a supplement that's been tested for purity and is free from contaminants like mercury and PCBs, which can unfortunately be found in some fish oil products. Your brain deserves the best fuel you can give it. Now we come to the fourth deficiency, and this one often flies under the radar: magnesium. Magnesium is involved in over 300 biochemical reactions in your body, and it plays a crucial role in brain health and memory. It helps regulate neurotransmitters, supports the formation of new neural connections, protects your brain from stress and inflammation, and is essential for converting the food you eat into energy your brain can use. Without adequate magnesium, your brain simply can't function at its best. Studies suggest that nearly half of older adults don't get enough magnesium from their diet, and deficiency is even more common in people with certain health conditions like diabetes, digestive disorders, or kidney disease. Medications can also deplete your magnesium levels, including diuretics, proton pump inhibitors, and some antibiotics. And here's the frustrating part. Magnesium deficiency doesn't always show up on standard blood tests because most of your body's magnesium is stored in your bones and tissues, not in your blood. So you can be deficient even if your blood work looks normal. The symptoms of magnesium deficiency can be subtle but impactful. Fatigue, muscle cramps, trouble sleeping, irritability, anxiety, and yes, memory problems and brain fog. Magnesium is particularly important for the part of your brain called the hippocampus, which is the memory center. Research has shown that magnesium helps strengthen the connections between neurons in the hippocampus, making it easier to form and recall memories. When magnesium levels are low, these connections weaken and memory suffers. One form of magnesium that's especially interesting for brain health is magnesium L-threonate. Unlike other forms of magnesium L-threonate has been shown to cross the blood-brain barrier more effectively, meaning it can get into your brain where you need it most. Early research suggests that it may actually improve memory and cognitive function, particularly in older adults. But even other forms of magnesium, like magnesium glycinate or magnesium citrate, can be beneficial for overall health and may support brain function indirectly by improving sleep, reducing stress, and supporting energy production. Getting more magnesium through your diet is a great first step. Leafy green vegetables like spinach and Swiss chard, nuts and seeds like almonds and pumpkin seeds, whole grains, beans, and dark chocolate are all excellent sources. But if you're not eating these foods regularly, or if you have absorption issues, a supplement can help. Most people do well with 200 to 400 milligrams of elemental magnesium per day, but always talk to your doctor before starting a new supplement, especially if you have kidney problems or take medications that might interact with magnesium. Now here's what I want you to take away from all of this. Memory loss after 70 is not inevitable. Yes, some changes in memory are a normal part of aging, but significant memory problems, the kind that interfere with your daily life, are often a sign that something is wrong, and that something is often fixable. These 4 deficiencies, B12, vitamin D, omega-3 fatty acids, and magnesium, are incredibly common in older adults, and they're all directly linked to brain health and memory. The beautiful thing is that once you identify and address these deficiencies, you can see real, meaningful improvements in how you think and remember. But I don't want you to just guess. If you're experiencing memory problems, I strongly encourage you to work with your doctor to get tested for these deficiencies. A comprehensive panel that includes B12, vitamin D, omega-3 levels if possible, and a look at your magnesium status can give you valuable information. And if you do have deficiencies, work with your healthcare provider to create a plan to correct them safely and effectively. I also want to remind you that nutrition is just one piece of the puzzle. Your brain health is influenced by so many factors: physical activity, mental stimulation, social connection, sleep quality, stress management, and managing chronic conditions like high blood pressure and diabetes. Taking a holistic approach gives you the best chance of keeping your mind sharp and your memory strong as you age. You deserve to enjoy this stage of your life with clarity, confidence, and the ability to remember the moments that matter. Don't let nutritional deficiencies rob you of that. Take charge of your health, get the testing and support you need, and give your brain the nutrients it's been craving. I've seen it happen time and time again. People who felt like they were losing themselves get a second chance at mental clarity. And it starts with simple, actionable steps like the ones we've talked about today. You've got this, and your brain will thank you.